Hi everybody. Today I want to talk about the rollout of the COVID-19 vaccine and a couple of areas where I think we can make a significant improvement in it. So, yesterday during some well child visits that I was having, I had some patients who had not yet gotten the vaccine. These are 12 to 16-year-olds coming in for their well checkups. And, in this group, we've got some people who, the moment they were able to get the vaccine, they signed up for it and got it and are well under their way of getting vaccinated or are already completely vaccinated, having received 2 shots. Then you've got some people who, they're dead set against it for various reasons, aren't going to get it, and basically lost causes. But there are a lot of people out there who they're kind of like out of it. It's just not on their radar. They don't think about it. They don't worry about it. They, if you talk to them and say, "Hey, you should get it," they say, "Yeah, all right, I'll do it." And then you tell them where they can get it and how to do it, but they just aren't motivated enough to make a phone call and schedule an appointment and go and get it. But if I had the vaccine in my office, which I don't, I could say, "Hey, you really should get the vaccine," explain why, and they would say, "Sure, okay." And I would give it, and they would get it, and that would be that, and it would be a done deal. But I, so far, can't get the vaccine, and that's not the way it's supposed to be. We've had several video conferences that were held by the state of New Jersey, the American Academy of Pediatrics New Jersey chapter. They spoke about how they are arranging this hub model, and that local vaccine distributors, like our local hospital in Spira, where I got my vaccine, are supposed to arrange to act as a hub and distribute some of their vaccine to the local physicians so that they can give it in their offices. I called in Spira. They were clueless. Nobody seems to know what the hell's going on. This has been like this for a couple of months now. And here it is on the news yesterday. We're going to give, the United States is buying from Pfizer 500 million doses of vaccine to give to the world. The countries that are poor, fewer resources than us, to help them get vaccinated, which I think is great. But I'm also thinking, well, Jesus, if we can give 500 million doses of vaccine to the world, why can't I get a few doses for my office? I think there's something wrong there. Hopefully it'll get fixed in not too much time, but, just pointing this situation out. The other situation is, even if I can get the vaccine, I have a bit of a logistic problem, because everybody's kind of, because it's a new vaccine and everybody's been a little anxious about it before we started giving it. Everybody's been real careful about that 15-minute observation period before you can leave. Well, if you've got a small office and limited space, and you're trying to keep people from contacting each other during what is still the pandemic, you don't want a lot of people sitting around together in a small space waiting their 15 minutes before they can leave. It'd be kind of silly to cause them to get infected while you're trying to prevent the infection. Given the millions of doses that have been distributed or given worldwide, I think it's safe to say that the risk of a serious allergic reaction following the COVID-19 vaccines is not any greater than any other vaccine we give, and shouldn't have greater restrictions. And it's generally, it takes almost 15 minutes between when a person gets the vaccine in an office and they're out the door anyway. So I think we should relax those restrictions a bit so that they're no more restrictive than the other vaccines we give, so that we don't have to have a special way of giving it. In other words, somebody comes in for their regular vaccines and they say, well, how about COVID vaccine? But I can't give COVID vaccine because I don't have a place for you to wait for 15 minutes because I've got patients, continually coming into the office for their scheduled appointments. See, that creates a bottleneck there. And then if we have to create special vaccine clinic days and stuff like that, then they might as well just go to the other vaccination centers and get it there, where they have those kind of clinics set up. So 2 things. 1, get the doctors their own supply. Let us order it right from the manufacturer. We have this program in New Jersey called the Vaccine for Children program, which was set up to help expedite the distribution of vaccines to improve vaccination rates of all the childhood vaccines. Let us get COVID vaccine from that too. What are we waiting for? Let us have easy access to the vaccine so we can give it to our patients, and ease up a bit on the 15-minute observation period following that vaccine to make it no more restrictive than the other vaccines we give. I mean, we have epinephrine in the office. We have to be prepared to handle any immediate reactions that occur anyway. Why does this one have to be more restrictive? I don't think we need to do that. I think we've got enough data now to say, hey, it's roughly equivalent in that sense to the other vaccines. I hope you found this information useful. Thanks for watching.